Hello students, today we are going to study about vitamins. Here we study about the requirements, the daily requirements, the properties, the deficiency of fat soluble and water soluble vitamins. So there are some deficiency conditions available. People suffer from deficiency condition of fat soluble and water soluble vitamins. So we'll study about accordingly in the coming slides. The term vitamins is derived from vital and amine, and vitamins are required for life and were originally thought to be actually amines. Chemically, it was thought to be amines. Vitamins may be regarded as a non-caloric organic compounds, means it doesn't give energy. There is no calorie that we get from the vitamins. It's not like carbohydrate, lipid and protein. When we consume them, we get some calories, but vitamins are not non-caloric compounds. Generally, these vitamins cannot be synthesized in the body and must be therefore supplied through the diet, and it performs a very special biological function in our body, so it has to be taken from the outside. And if we though it cannot be synthesized in the human body, it should be taken from the outside, and if we fail to take from the outside, we usually get some abnormal condition in our body. The deficiency conditions will be seen in differently for different vitamins. So here this is a classification. Vitamins are basically classified on the basis of their solubility. There are two types of vitamins on the basis of solubility: fat soluble vitamins and water soluble vitamins. Fat soluble vitamins are of basically five types. No, four times, sorry. It's A, D, E, and K, ADEC. And the water soluble vitamins are of two types: vitamin C and vitamin B complex. Okay, so vitamin B complex, if you see, the name is very it's a given complex, so there are so many vitamins are there included in vitamin B. They are grouped into two types, okay, based on the function. The B complex vitamins are energy releasing vitamins as well as hematopoietic vitamins. So the vitamin which are energy releasing are basically B1 thiamine, riboflavin which is B2, and niacin which is B3, and pantothenic acid, vitamin B5, pyridoxine, vitamin B6, biotin, vitamin B7. So there are 1 2 3 4 5 6 vitamin B which are energy releasing, and there are two vitamin B which are hematopoietic, which are helpful in the formation of blood, which are basically folic acid, also known as vitamin B9, and cyanocobalamin, which is vitamin B12. So this total 6 plus 2 8 vitamins are there in the B complex vitamin. So how to remember these 8 complex vitamins? So there are one sentence which is easy, which will help in remembering these all 8 vitamins. So the sentence is: tender romance never fails with 6 to 12 beautiful pearls. So in this sentence, the first letter of this sentence are named as a name of the vitamins, like tender, the T, which means thiamine; romance, where R means riboflavin; never, N stand for niacin; fails, F stand for folate; and then 6 means basics, 12 means B12, beautiful means here biotin, and poles means pantothenic acid. So accordingly we can practice and we can remember the name of the all 8 vitamin B complex. Okay, so this is the comparison between water soluble vitamins and fat soluble vitamins. Okay, so based on the solubility, as you discussed in the previous slide, that water soluble vitamins are soluble in water and fat soluble vitamins are soluble in fat. Absorption of these water soluble vitamins are very simple, whereas fat soluble vitamins are absorbed along with lipids, so it is little bit complicated absorption for fat soluble vitamins. So storage now, where water soluble vitamins are not stored in the human body, if there is excess in amount, then the excretion we can see it's excreted out. So fat soluble vitamins now we see they're stored in liver and they are not excreted. Whatever you take, it gets stored in the liver and not excreted. So accordingly, if you take excess intake of water soluble vitamin, then it is non-toxic because it get excreted. And fat soluble vitamins, though whatever you take, the excess intake get causes the it causes that it is stored in the liver, they're not excreted, and now it causes the toxic to the body, the toxic to the liver cells. So excess condition leads to toxicity also. Deficiency of water soluble vitamins, so manifestation is very rapid, easily and very rapidly we can see the signs and symptoms of deficiency of water soluble vitamins. And deficiency condition of fat soluble vitamins are very the manifestations are very slow. The signs and symptoms will slow because they're stored in the human body, and if you do not take for 1 week, 2 week, 3 week, then deficiency conditions, the manifestations will not be seen or may be seen very slowly. Now what is the treatment for water soluble vitamin deficiency? So simply, if the doctor will advise to take the supplement, so you can take the regular dietary supplement or you can take the capsule. And fat soluble vitamins, where you can take one single large dose and we can get cured. Okay, so vitamin A now let's know. So there are two forms of vitamin A. One is retinol and the second is a beta carotene. So retinol, basically this kind of vitamin A are derived from the animal foods, and beta carotenes which are derived from the plant foods. Okay, so now the retinol named because of its concern with the retina of eyes. And this beta carotene, if you see, this is basically present with the chlorophyll in plants, chlorophyll found in chloroplast of the plant. So this is present in chlorophyll, okay, and converted to vitamin A in human gut. So when you take beta carotene, so your human, you means we human that have intestine, and it would be beta carotene will be converted to vitamin A in our intestine. So how much daily allowance is here? The recommended daily allowance, it's 1,000 microgram per day. Next, what is the function of vitamin A? These are the vital function. It regulates the growth, it promotes the healthy skin, maintain healthy tissue, and helps eye adapt to dim light, and also help in the moisturizing also. So this is the moisturizing vitamin A sources are basically the animal source. Vitamin A means animal source. Basically it was invented in animal source, called liver oil, liver, dairy product, herring, and egg yolk. Beta carotene, basically they are found in dark green vegetable, broccoli, carrots, deep orange, fruits, and vegetables. Okay, so effects of deficiency, you can see here: retarded growth, malformed, long term may lead to night blindness, and if there is a susceptibility to infection as well. Excess beta carotene may lead to liver and bone damage also. So do not take excess beta carotene because it may can affect the liver, and it can also damage the bone sometimes. Now function of vitamin D: absorption and laying down of calcium and phosphorus in bones and teeth, regulate calcium balance between bones and blood, prevents rickets. Recommend dietary allowance of vitamin D is 5 microgram per day. So here the vitamin D, basically the source is sunlight, fish liver oil, dairy products, oily fish, and margarine. Deficiency condition of vitamin D is basically related to the, in children it is rickets, and in adult it's osteomalacia. So conditions where bones are soft and cannot take weight of the body. So osteomalacia means these are the one of the conditions which where bones are soft. Osteoporosis where one bone become light and dense, prone to, less dense and prone to fracture. Dental caries may occur because of lack of vitamin D. Vitamin E is found in basically uh, non non-vegetarian foods. It protect the tissue against damage. So the normal function also is promote normal growth and development, helps in normal red blood cell formation. The three function of vitamin E. So we discussed here. The recommended dietary allowance is 15 mg per day. The sources are here egg yolk, cereal, whole bread, vegetable oil, wheat, sunflower. Okay, deficiency condition is rare, and could not affect it could affect the central nervous system. Vitamin K, which is needed for blood clotting. K means clotting, which means it helps wound healing properly, and there is increasing evidence that vitamin K is also needed to help build strong bones. So these are the main vital function of vitamin K. So chemically it's a naphthoquinone, and the recommended dietary allowance is 70 microgram per day. Sources of vitamin K is green leafy vegetables, vegetable oil, cereals. The effects of deficiency, since vitamin K helps in clotting, so deficiency is basically very rare, but the individual with the liver damage and newborn infants are at high risk because of the symptoms will be like the bleeding. Okay, B1 vitamins. Thiamine, basically this has a role like essential for release of energy from a carbohydrate necessary for appetite and good health, need for normal functioning of the nervous system. Dietary allowance is 1.5 mg per day. Sources are like meat, oatmeal, breakfast. So all vegetarian, non-vegetarian foods normally contain thiamine. Deficiency conditions are like fatigue, depression, irritability, and the most commonly is beriberi, which is a disease of the nervous system. Riboflavin deficiency, B2, where the function is similar to the thiamine, metabolism of carbohydrate, protein, and fat. It helps in the growth, repair, development of body tissue, healthy skin, eyes, and tongue. And the principal growth promoting factor in the vitamin B complex here, the growth promoting factor, one of the best growth promoting factor. Dietary allowance is 1.7 mg per day. Here the sources are similar to thiamine of milk, cheese extract, green vegetables. Deficiency condition leads to loss of appetite, swollen tongue, cracked lips, eye infection. So it's basics. Basics is important for maintaining healthy brain function. The formation of red blood cells, the breakdown of protein, the synthesis of antibodies which support the immune system. Dietary allowance is 2 mg per day, and B6 is usually found in animal source, fish, poultry, whole grain, fruits, vegetables. Dietary allowance is 1.3 to 2 mg per day. Okay. B6 deficiency leads to weakness, sleeplessness, and peripheral neuropathy, personality changes, dermatitis, glossitis. Function of vitamin B12. Here it helps in the formation of blood cells, okay, and maintain the central nervous system like brain and spinal cord. Sources of vitamin B12 is meat, poultry, seafood, eggs, milk, and milk products. Daily requirements is 2.4 microgram per day. Deficiency causes anemia. Vitamin C usually is critical to immune system function of connective tissue, collagen. This has an important role in the formation of connective tissue like collagen. It helps in the absorption of iron, prevents scurvy, promotes healing of wounds. Right, okay, it not prevent, it promotes healing of the wounds, healthy blood vessels, acts as antioxidant, protects cholesterol. Okay, so these are the vital functions. Dietary requirements are 60 mg per day. So available sources are like receipts, black currants, green pepper, kiwi, citrus, grapefruits, strawberries, spinach, cabbage, broccoli. Okay, deficiency conditions are like weakening of connective tissues, susceptibility to infection, incomplete iron absorption, delayed healing of wounds, and it prevents scurvy, which is like pale skin with spot bleeding, soft gums. Okay, so we studied about the vitamins in detail. We studied classification and different types of vitamins. Thank you for listening.